Ebola virus disease, EVD, commonly known as Ebola, is a severe and often deadly viral illness that affects humans and some primates. Here's a detailed explanation of Ebola. 1. Virus and transmission. Ebola is caused by the Ebola virus, which belongs to the Filaviridae family. There are 5 known species of Ebola virus, with 4 of them known to cause disease in humans. The virus is transmitted to humans from wild animals and spreads through direct contact with the blood, secretions, organs, or other bodily fluids of infected animals, such as fruit bats, chimpanzees, gorillas, monkeys, or duikers. Human-to-human transmission occurs through direct contact with the blood, secretions, organs, or bodily fluids of infected individuals, as well as through contact with surfaces or materials contaminated with these fluids. 2. Incubation period and contagiousness. After exposure to the Ebola virus, the incubation period ranges from 2 to 21 days, with an average of 8 to 10 days. During this period, individuals are not contagious and do not exhibit symptoms. However, once symptoms appear, they become infectious and can transmit the virus to others. 3. Symptoms. Ebola typically starts with flu-like symptoms, including sudden onset of fever, fatigue, muscle pain, headache, and sore throat. These symptoms are often followed by vomiting, diarrhea, rash, impaired kidney and liver function, and, in some cases, internal and external bleeding. Severe cases can lead to organ failure and death. 4. Severity and mortality. Ebola has a high case fatality rate, ranging from 25% to 90%, depending on the specific virus strain and the quality of medical care available. The mortality rate can be influenced by factors such as the timeliness of diagnosis, supportive care, and the overall health of the affected individual. During outbreaks, the case fatality rate may be higher due to limited resources and infrastructure in affected regions. 5. Outbreaks and geography. Ebola outbreaks have occurred primarily in Central and West African countries, such as the Democratic Republic of Congo, Sudan, Uganda, Guinea, Sierra Leone, and Liberia. These regions have experienced multiple outbreaks due to factors such as proximity to animal reservoirs, inadequate healthcare infrastructure, and limited resources for outbreak response. 6. Diagnosis and treatment. Diagnosing Ebola requires laboratory testing to detect the presence of the virus or its genetic material in blood samples. Early diagnosis is crucial for patient care and to prevent the spread of the disease. Supportive care is the primary treatment for Ebola, including managing symptoms, maintaining fluid balance, and treating other complications. Experimental treatments and vaccines have also been developed and used during outbreaks to improve patient outcomes. 7. Prevention and control. Preventing and controlling the spread of Ebola involves implementing various measures. These include identifying and isolating infected individuals, tracing and monitoring their contacts, practicing good hand hygiene, using personal protective equipment, PPE, during patient care, promoting safe burial practices, and raising awareness about the disease and its transmission among communities. Vaccination campaigns have also been conducted to protect at-risk populations. It's important to note that the information provided here is based on the knowledge available up until September 2021. For the most up-to-date and accurate information on Ebola, it is recommended to refer to reputable sources such as the World Health Organization, WHO, or the Centers for Disease Control and Prevention, CDC.